I was doing probably 8 hours of therapy a day. I would wake up at 4 and spend 2 hours clearing out my lungs before my daughter woke up to get ready to go to school because I wanted to be able to interact with her without feeling short of breath and crabby from that. And then she'd go to school and I'd go home and I would do therapy for as long as I could physically do it. And then normally we'd, get her to bed at whatever time. So I'd have 3 or 4 hours with her when I could breathe well. But normally after about 3 hours, my lungs started to fill up again and I couldn't breathe. My last hospital stay, I told my friend, I think this is going to kill me.
This is Family Portraits, a podcast series by Sanford Health. And now, Alan Helgeson with Sanford Health News.
If you think about your childhood and that fun, carefree spirit you had as you bounced through the days, it probably brings up a smile and maybe a glow to your face and a mental image from that time. Well, what if that memory was filled with question marks, unknowns, and dark clouds that even medical experts at the time could only shrug their shoulders at what might lie ahead? Well, the dizzying rate at which medical advances happen these days probably doesn't even give you a second thought about what's possible. If we went to 1974, it wasn't quite the same. No iPhone clouds. Clouds were only something we looked up at. And medical breakthroughs? We first learned about the Heimlich maneuver in 1974. The patent was granted for the MRI machine, and the first Tommy John surgery was done. We didn't hear about these things on TikTok, though, or Snapchat. Still, for other areas of medicine in 1974, it was very much a frightening world, especially if you were born with a genetic disease.
I was diagnosed with cystic fibrosis at the age of 3 months when my mother noticed some irregularities between my body and my older brother's body. Something about my skin was tacky, and she thought that was not right.
That's Chrystal Moldenhauer. Now, if you don't know about CF or cystic fibrosis, the outlook then was not very good.
I believe they were told I may not make it 1 year. It was very much a childhood illness. Kids did not live past their elementary years, for sure.
Before we go much further, we jump right into what you might be told in 1974. But now let's talk about what CF is.
Cystic fibrosis is a disease of the exocrine glands, so any gland that excretes anything is affected. I believe it makes secretions dehydrated, so much thicker throughout the body, and it causes the most problems in the GI, the digestive tract, and then in the lungs and sinuses. So typically you'll see people with cystic fibrosis maybe look a little malnourished, and they cough a lot.
As you're probably putting together, not a lot of options for treatments.
They did the pancreatic enzymes for digestion, and they did percussing with the hands to try and loosen secretions in the lungs, and I think that's all I know of. That's all they did for me. I'm sure they had antibiotics and such, but I wasn't that sick yet back then. I was considered to have a mild case at that point. I didn't struggle with it until probably I was, 15 maybe, was my first hospitalization. So I made it quite a while, being pretty healthy.
Okay, so as you followed along the last few minutes, Chrystal seemed to have things a little bit better than what they maybe could have been, given her condition. So how did we get here today? Well, that's the strange path of a genetic disease. It takes you to strange places you don't expect. Kind of like Chrystal's journey and growing up in her family.
They treated me like a normal kid for the most part. I had to take digestive enzymes when we had meals, but other than that, I didn't have a whole lot of special allowances made for me. So I was expected to do the chores and to contribute to the to the family, and I had a paper route in 7th and 8th grade, and I was expected to ride my bike. You know, it felt like tough love, but it was good for me in the long run. When I got sick at age 15, then I started to be hospitalized probably quarterly for 3 weeks at a time. And then there were obviously some changes that were made. You know, I was allowed to have special exceptions for homework, due dates and stuff in high school.
Chrystal is 15 now. This would be around 1989, and things would start changing.
Yep, I contracted Pseudomonas aeruginosa, most likely from a CF camp where we were all together, you know, enjoying each other's company, but not realizing we were sharing bacteria. It's a bacteria that once it's in our lungs, it never goes away. And it becomes a superbug. It becomes resistant to antibiotics, which is what happened to me. So by the time I turned 18, they had been so aggressive in treating me that they had run out of antibiotic options and told me, we can't do anything else for you. Because that particular CF center didn't know about some of the different airway clearance options that were available.
When you think about a bug, a bacteria that never goes away, what does that mean to someone like Chrystal that has cystic fibrosis?
It always is active. I always have a low-grade lung infection, so I always do therapy twice a day to keep my lungs cleared up. Anytime I get a cold virus, it kicks usually down into my lungs and flares up the Pseudomonas bacteria.
While talking with Chrystal and her family, at this point, she made eye contact with her daughter, and they smiled at each other. So I had to ask them what was going on. It happened to be about the cold virus and how it affects life at their house.
Well, we chose to homeschool because the virus activity in grade school was manageable, but then when COVID hit, it became a real hardship. Every virus is dangerous for me, but COVID was especially. So we pulled her out and started homeschooling, which we're enjoying, but we still allow her to do extracurriculars with her friends. And so when she brings home a virus, we try very hard to not share it. Sharing is good, but not that.
So when family, brothers and sisters from my side or her side want to come visit, we always have to be very careful. Have they been exposed to any viruses, you know, for a week or so before coming to visit us, because we just can't run that risk of Chrystal getting sick again, if it can possibly be avoidable.
That's Lucas, Chrystal's husband.
Because cold and flu season is right around the corner, and that's when all the best holidays start. And right, Thanksgiving, Christmas, Easter, all smack dab in the middle of cold and flu. And so it's definitely a challenge, because I have 5 sisters and she has a number of siblings, and what are the odds that everyone's going to be healthy?
For Hadassah, Chrystal and Lucas's daughter, it's hard for her friends to understand those extra steps needed for things we often take for granted, like the sniffles.
Sometimes I just go to school with like a mask on, and everybody's asking me questions and saying, "Why do you have a mask on?" And I'm just like, I want to say, because you're really sick. You're always just sick. And I'm like, probably shouldn't say that. So I just say, I just want to keep the risks down, and my mom has a disease, and whenever she gets sick, she could possibly go to the hospital. It's always a possibility. When I was younger, if I ever got sick, she almost was in the hospital.
And it's for reasons like this that Chrystal and her family are extra cautious.
So CF has become a very isolating disease. You can't go to support group with other people who have it. The movie 5 Feet Apart kind of shows that we not only keep a physical distance, but the CF Foundation recommends having one person in the building who has cystic fibrosis. So my husband had a work party for Christmas, and one of the spouses had CF, so I didn't go. because it's just not worth risking me giving my bacteria to him and vice versa. So it's makes you feel isolated and alone in that part of it. But I think a lot of people overcome that with online connecting. It's not the same, but it's something.
For people with cystic fibrosis like Chrystal, there are some things that we might not think about that are a pretty big deal.
It's been probably two big things I've noticed. When people are struggling with a cold virus, they'll often say, "Oh, it's no big deal, it's just a little sniffle." And I bite my tongue because I want to say there's no such thing for me. There is no little sniffle. Every virus can be a big deal for someone who has a superbug bacteria in their lungs that they're struggling to keep under control, but when it flares up, you don't know always if the drugs are going to work to keep it keep it back down to a manageable level, or if it's going to be the last virus you have. The other thing I think I've noticed in my adulthood is when people make comments about, "Hey, are you short of breath?" or "Why are you breathing like that?" or, like they draw attention to it. It doesn't help the situation because I'm already self-conscious about my breathing.
Because of the medications that came out 15 years ago and then 10 years ago, and then again 5 years ago, her quality of life has gotten so much better. But like when we got to know each other back in college, it was a terminal disease then, and it still is a terminal disease now.
While talking with Chrystal and sitting with her family at their dining room table, she would have really hard breathing at times. You can probably hear it. I asked her if I could mention that.
Yeah, a lot of times, I still remember the times people have commented on my breathing because we were walking up a hill or doing something, and I wanted to just tell them, look, I'm really proud that I'm able to walk up this hill. Don't discourage me.
So while we're here today and Chrystal is telling us her story, for people with CF, the simple process that we probably don't think much about having to do is a lot, and I mean a lot of work for Chrystal. For many people with CF, treatment may have included using a vest.
Well, I can tell you what I know from my experience, and that is that it is a vest you wear and you hook it up with air hoses to a machine that pumps air out at different frequencies and different pressures. And so you're breathing against a vest that's filled with air, so it's a workout. But it shakes your chest at different speeds. The idea being that as you breathe intentionally, deliberately, deeply, you're sitting in a chair usually, and I have a nebulizer with medicine in it that I'm also inhaling. And then it makes you cough. It stimulates a cough. And then the coughing is what clears out the infected mucus.
Now, it wasn't only one time a day, right?
Well, at that time it was twice a day. But I was not really compliant because I just figured, well, I'm going to die anyway, so who cares? I mean, I wasn't dating Lucas yet. Didn't have, obviously, a child, so I didn't have a whole lot that I was trying to live for. So I just kind of blew it off.
So why would you not do it if you know you needed to?
Throughout my life, my birthdays have kept up with the life expectancy. So, for example, when I turned 21, I thought it was my last birthday because the life expectancy was 22 at that time. So I was messed up most of my birthdays.
And the vest is still important today?
Yep, very basic, but it works. And when I get sick today, I will do more vesting. And so then I'm coughing out more junk, and you try and get the bacteria load down in your lungs by getting the junk out.
As a kid that really defied the odds with each year, and then here we are now. Imagine life as a kid, and then the stages of growing up, and the grit and determination it takes to get through it all.
I was starting at a new school. We had moved to a new town in Wisconsin, and I had to wear this weird metal brace thing on my face for orthodontia, so everybody was pretty much distracted by that and not noticing my invisible disease, my breathing problem, until we got to basketball practice in the afternoon. So most of the day went fine. I would attend class and just look like a normal kid. And then when it was time for basketball practice, the other 9 players would run up and down the court, and my coach made me stand in one place because he didn't like to hear me cough. And then after that, I would go home and I'd have to practice trumpet or something. You know, I picked the instrument that needed the most lung power. That's okay. It was worth a shot. And then I think mealtimes was always something I really looked forward to because I had quite the appetite. Because I didn't take my enzymes faithfully, so a lot of the food I ate just went right through me, and I'd just be really hungry all the time.
Chrystal, while we were talking, I learned that going through everything, she learned to be really quite the fighter, and it applied to pretty much everything in her life, including her school.
It was a preparatory school, and it was very competitive, and I'm competitive. So I think probably I felt like it was the one thing I'd do in my life because I thought that was going to be the length of my life was high school, maybe a little bit into college. So I probably studied too hard and missed treatments and set myself up for a cycle of getting sick and then having to get back to school and catch up, which caused me to get sick again. You know, probably was a thing for me, a pattern.
That didn't seem to slow her down. She would go on to become the class valedictorian.
And I was also a homecoming queen, I would like to say. Which was a long time ago in a galaxy far, far away. But, I thought that was all it was going to be for me. So I was going to make it as big as I could in that venue.
During this time, Chrystal had a very difficult home situation, and over the course of several years, in the ages of 18 through 25, she would say she was homeless by choice.
For that period of my life, CF saved my life in a way. I had very supportive social workers at the CF Center in Wisconsin.
Her academic achievements would cover her tuition, and aide would take care of room and board during the school year.
Holidays were tough, being alone in the dorm for Thanksgiving or Christmas or Easter if a friend couldn't take me in. But then, like, during the summers, I'd have friends house me 2 weeks here, 2 weeks there, because they all knew my home situation as well. So they wanted to help me stay healthy.
And almost no contact with parents.
Very little. It just wasn't a healthy... I didn't get along with my stepmom. So it was a two-way street, and it's much better now. But yeah, I had to cut off contact just for my own well-being and sanity at that point.
So eventually, school comes to an end, right? Maybe. Well, Lucas came into the picture.
I'm just driving home, thinking of you. I'm wondering if you miss me too.
We met when I was 23. I was finishing up year 5 of a 7-year journey through a 4-year degree. I think I visited his family at the beginning of that summer, and it was probably early June, and his mom asked, "So, how long can you stay?"
I have 5 sisters, so what's one more girl in the house?
Chrystal and Lucas, school sweethearts. A college love story that'll just make your heart sing.
I was second alto, and he was first tenor.
Eventually they married, and then things get tricky. Remember, CF doesn't really stop and wait for love.
Right after we got married, we moved to Wisconsin so he could be in the seminary near Milwaukee. After the 4 years of seminary, we requested that the church send us back to Minnesota so that I could go to the University of Minnesota again. And so that happened, thankfully. We lived in the Twin Cities Metro for a dozen years until I got tired of the traffic. And I asked my CF doctor in the Twin Cities for a recommendation for another CF center with the same level of care, because the Minnesota Center was world known as probably the best one in the world. So they recommended Sanford. And I said, where is that? Sioux Falls, where is that? So I've never been here, but we tried it, and that was 2012, and loved it.
They loved it, but they drove quite a bit each time they came to Sioux Falls.
So it was a horse apiece. It was an hour and a half-ish to the cities or an hour and a half to Sioux Falls. But the traffic was much easier coming west, so that was a good thing. We didn't know it at the time, but I was pregnant. My first visit to the doctor in Sioux Falls, because I had started the new medicine 5 months before.
Which new medicine?
Kaleidoco. There we go. Yep, Kaleidoco. Anyway, so I had started that 5 months before, and they had said there's a chance you can get pregnant, and we both kind of laughed because we'd been married 13 years by that point, and yeah, we were pregnant. Just didn't know it at that time. We were very new, like 6 weeks or something.
A baby.
Again, the miracles of all the blessings of the new meds that kept coming out in her lifetime to just keep pushing that life expectancy further out, further out, further out. Yeah, so we were coming out here to Sanford, fell in love with the care, fell in love with Sioux Falls as a community. I've told this hundreds of times, how just walking down the sidewalk in Sioux Falls, people would wave at us that we didn't know. And they would wave with all 5 fingers. In Minneapolis, we were used to getting waved at with just 1 finger. So we fell in love at so many levels.
We've been talking about CF, and now Chrystal and Lucas are expecting. Unfortunately, more health issues.
For me, I have diabetes as well, CF-related diabetes, which acts like type 1, so I take insulin. So for me, that was almost a bigger deal than the cystic fibrosis. But the diabetes part, we managed very aggressively and deliberately, and Sanford was amazing for that. They stayed in contact and got my numbers every week that I was recording and making sure that the baby wasn't getting too much of whatever is bad if you have diabetes and you're pregnant.
Not just pregnant.
Very much, yes. High-risk pregnancy, yes.
Thanks to the expert high-risk OB team at Sanford Health, baby Hadassah went nearly full term.
At 38, I called and said, I can't breathe now. I need to be done. So they induced at 38 weeks. And I refused pain meds and the nerve blocker because I had to still do therapy and I needed to be able to walk around and get up. So yeah, it was a natural birth and went great.
And they just kept driving back and forth from New Ulm. You get to know which convenience stores have the best coffee and donuts along the route after a while. A long while.
We did that for my entire pregnancy until she was a year old, so for 2 years. And then we moved back to Wisconsin. So we never moved to Sioux Falls at that point. We moved to Wisconsin to give her a chance to get to know her 27 cousins in Wisconsin. And I tried a different CF center there and also had poor results. So then I started commuting from Wisconsin, not moving here yet. We commuted for almost a year, I think. And every time I'd be hospitalized, they would come and stay in a hotel for that 2 weeks. So we were draining our savings, and we were also paying rent in Wisconsin, and et cetera. And I was getting sicker and sicker because the new medicine had stopped working. And they were developing a newer one, but I wasn't able to take it yet. So that was when we made the decision when she was 3, we need to move to Sioux Falls so we can be together as a family. Otherwise, she's not going to have a mom for much longer.
Unfortunately, with Chrystal getting sicker, another move was necessary.
He didn't have a job. We didn't have a job. We knew one person. We had a place to rent, and when we were sitting there signing the lease papers, we said, hey, do you know anyone who needs a handyman, someone who's good at building things? And the landlord said, actually, yeah, I do. And that led to a job that lasted for 6 years, and it led to so many connections, and pretty cool.
Some of those connections began way before coming to Sioux Falls, with a willingness to embrace science and clinical trials for CF research.
So I've always been interested in clinical trials, partly because I know the drugs can't be developed unless people volunteer to take them, and I always try to come in at the end of the trial process, so it's been proved safe. And the clinical trial for the drug Kalydeco, I was involved in it in 2008 already. So then I am on standing notice with my friend at the University of Minnesota. If there's a trial that I can be in, they let me do that. I've done them in Ohio. I've done them here in Sioux Falls. Just anything to get some newer meds going. Thankfully, Sanford and University of Minnesota work together, so they share information and they'll call each other and say, hey, this is a study that Chrystal might want to do. They all know I want to be in them. Sign me up.
Meanwhile, things just kept getting worse for Chrystal. Over the course of several years, the average day was filled with therapy of just trying to stay alive.
It was rough. I was doing probably 8 hours of therapy a day. I would wake up at 4 and spend 2 hours clearing out my lungs before my daughter woke up to get ready to go to school, because I wanted to be able to interact with her without feeling short of breath and crabby from that. And then she'd go to school and I'd go home and I would do therapy for as long as I could physically do it. And then I would take a break and walk the dogs or take a nap, and then I would get right back at it until I picked her up from school. And then normally we'd, get her to bed at whatever time. So I'd have 3 or 4 hours with her when I could breathe well. But normally after about 3 hours, my lungs started to fill up again and I couldn't breathe. So then my husband would have to take over and I would go do therapy and then go to bed and get up and do it the next day. It was my full-time job.
No time for work elsewhere or hobbies.
That was it. Yep. Nope, I didn't have a job. My last hospital stay, I told my friend, I think this is going to kill me, because I just could not get ahead of it.
In 2019, Chrystal began taking a medication for CF.
Well, I remember taking the medicine for the first time. When I took it the first time, within an hour or two, it was like reverse drowning in a way. Stuff was coming out. Without any effort on my part, which is saying a lot, because I was struggling to clear secretions before that medicine, and this just thinned everything out, and it just was coming out for hours, for about a day and a half probably. And then it was all out. There was nothing left in there.
That was 2019. Now today, thanks to research, clinical trials, amazing medication breakthroughs, and clinical expertise, Chrystal's daily routine is a lot different.
So now I do a similar thing. I get up earlier than my daughter and I get my therapy done, but it's just a half hour. It's not 2 hours. And then I'm good to go until bedtime. So I have however many hours that is, 14 hours that I can have a job, which I have now, and do homeschool with my daughter and do all her extracurriculars and do chores around the farm and whatever I want.
Oh, and they have a few animals to care for too.
So we have almost 80 animals here, chickens and sheep and dogs and cats, and so I enjoy animals and I'll feed them and make sure their water is set and take care of any cuts or bruises or illnesses.
Chrystal, Lucas, Hadassah, and their more than 6 dozen critters are doing great. Does this mean that Chrystal still doesn't need medical care these days?
So I still see the pulmonary care team here at Sanford, and that's probably every 6 months instead of quarterly. It used to be every 3 months, so now it's every 6. And once a year I'll see the endocrine for the diabetes. And then as I age, you have those other issues that probably come up with just basic family practice doctor stuff. So I actually have, for the first time in my life, a normal family practice doctor. I've always just seen my CF doctor so often that I never bothered getting a normal doctor. I'll do my yearly checkup with her and then the normal female stuff or whatever, But that's about it for me.
And for their daughter, while you may be wondering, how is it determined if she may or may not have CF? Chrystal and Lucas already know the science.
So children of CF parents will always have the gene. They'll have one copy because each parent passes one copy. So if both parents have CF, then yes, they'll have 2 genes and possibly the disease. She just has my gene because Lucas doesn't carry it. So she has one copy of the CF gene.
Hadassah knows having this one copy makes her special.
Well, my mom always tells me that I have to drink a lot of, or not drink, what? I have to eat a lot of salt, or not like just put it in a spoon and just, I like salt more because my mom always tells me that me and her both lose a lot of salt in our sweat, so we need to eat more salt on things. I don't know if this is with a lot of kids, but when I'm running, most of the time, if I run for too long, it gets hard to breathe a little bit or stings, which is just, I think it's probably just because of my mom. And then, my gene. And then whenever I get sick, I get extra sick.
So, what would Chrystal today tell 15-year-old Chrystal?
Oh, boy. Good question. Oh, man. I don't know. Chill out, maybe? I mean, don't worry so much. It's going to work out.
A lifetime of experiences and many miles to get to specialist care have made Chrystal stronger and lead her and her family to a community where care and cutting-edge research go hand in hand.
Yes, I've found real lasting partnerships with the care team here in Sioux Falls at Sanford. People that really know their stuff, but they also know that I know my body. So they're very respectful and open to my ideas and my input. And they're more supportive of me not wanting to lose ground. I've had other experiences in other care centers where I was told, well, you have to expect to lose ground. It's a progressive disease. And in my last virus I fought with back in spring, my doctor said, we did 1 round of antibiotics and you're not back to baseline. I don't think we should stop, Chrystal. Do not accept anything less than your baseline. And I was like, wow, that's awesome. That's why we're here, is for that. A little bit aggressive, but I love it. That's what I needed.
Here we are where we wanted to be, where we needed to be, even though sometimes we didn't know we wanted to be here, but we found home, and we love the Sioux Falls Metro. We love the Sioux Falls Sanford medical team, and it's just all come together.
I've been waiting all my days to be truly blown away, and all that I can say is you were worth the wait.
God always gives us what we need. And He puts us where we need to be with the people we need. So I'm just very thankful.